Did you see the injury that Phoenix Mercury star Satou Sabally suffered during the WNBA Finals? She suffered a head and neck injury and was helped off the court in a way that's raising red flags from many medical experts, including myself. So let's break down what went wrong and how to safely handle these injuries. So in Game 3 of the WNBA Finals, Sabally crashed into an opponent's leg while she was going up for a rebound. She came down, her head hit the leg of an opponent, and she struck the leg, and she clutched her face after the injury, and she seemed confused. She laid on the floor for several minutes. She was manually helped up and walked off the court with support, and she was later diagnosed with a concussion and ruled out for Game 4. Now, this is where things get alarming. When someone suffers a head injury, there's always the possibility of a cervical spine injury, especially since she was clutching her neck, or even a more severe brain injury. And if you start moving them without stabilizing the neck, you risk secondary injury, meaning damage to the spinal cord, worsening a brain injury, or even paralysis. And what we saw in Sabally's case, her head and neck were not visually stabilized before she was helped up, and she was walked, not immobilized, which increases the risk if there is a neck injury. Concussion protocols are not just check boxes, they really exist to protect athletes' long-term health. So here's what you need to know and how to handle injuries like this. Number 1, don't move them immediately unless there's imminent danger. Number 2, stabilize the head and neck. Hold the head still with both hands, minimal twisting of the neck or any bending. 3 is the ABCs, which we know in trauma: airway, breathing, circulation. Make sure she's breathing, the pulse is present. 4, look for sign of spinal injury like numbness, inability to move limbs, pain in the neck or the back. And 5 is call for advanced medical help like spine boards, cervical collars, and trained paramedics. If you must move the patient, make sure you move the head and neck together as one unit and maintain alignment. And lastly, monitor for concussion symptoms like confusion, dizziness, headache, vomiting. And in professional sports settings, medical staff is there, and they should have cervical collars, immobilization boards, and strict protocols before any lifting or movement. Now, in Sabally's case, many believe the decision to help her stand and walk without strong, visible neck stabilization may have exposed her to unnecessary risk, and head and neck injuries should never be considered trivial. So if you see someone that has a fall or hits their head hard, remember, don't move them prematurely, stabilize the neck, and get professional help. We owe that to that person.